Assalamu alaikum. Hello everybody, I'm Dr. Khalid Al-Amin, and this is our second lecture about the pelvic floor or the pelvic muscles in this course of the reproductive system. So in this lecture, we are supposed by the end of this lecture to appreciate the importance of the pelvic floor, why we need to study the pelvic floor, and would be able to describe the components of the pelvic floor. So let us go to study this pelvic muscle, and these pelvic muscles, they form what we call the pelvic floor or the pelvic diaphragm. We have to be familiar with this term, the pelvic floor or the pelvic diaphragm. And this pelvic floor is formed by the levator ani and coccygeus muscles. The pelvic floor is formed by these two muscles. You know the meaning of floor. So this is the inferior wall of the pelvis, while the obturator internus and piriformis make the lateral wall. They are not part of the pelvic floor or the pelvic diaphragm. No, obturator internus and piriformis are on the lateral side of the wall. So if you look at this picture, these parts here in brown, they are the lateral wall, which is formed by the obturator internus and piriformis, but lower down here in green, this is the pelvic floor, which is formed by levator ani and the coccygeus muscle. The pelvic floor, as we mentioned, is a funnel shaped structure. It attaches to the walls of the lesser pelvis. You are now familiar with this term. This is the true pelvis or lesser pelvis, and separates the pelvic cavity from the perineum inferiorly. Okay, so we have another part below to the pelvic floor, and this part is the perineum. So this pelvic floor will separate above the male and female pelvic viscera, and lower down we have the perineum. We can see a picture for this looking from the lateral side. This is the sacrum. Here this is the hip bone. This is the pelvic floor or the pelvic diaphragm. This is the symphysis pubis anteriorly. So what is seen here is the perineum and then the side. Okay, at the perineum we can see in the male, for example, the penis and the scrotum. In the female we have the vulva and the external female genitalia. Okay, the pelvic diaphragm and this pelvic floor, as we mentioned, we have extension from the pelvis to the perineum. So we have certain structure which pass there, and this include the rectum, the urethra, and the vagina, definitely in females. So in both sexes, male and female, we have the rectum and the urethra. In females, we have additional opening, which is the vagina, which opens to the outside at the perineum. So if we are looking from superior at the pelvis, we can see from posterior, this is the rectum here, and this is the vagina, and this is the urethra. So this is a female section. This is another female section. This is the sacrum posteriorly. So this is the rectum, and this is the vagina, and this is the urethra. Okay. So this is another female section. You can see here. This is the pelvic floor. Below down, this is perineum. This is the pelvic floor. As we mentioned, it is formed by levator ani and most posteriorly coccygeus muscle. This is another section for the female. Let us examine a male section in which you can see two openings of the rectum and the urethra. This is a male section, two openings, the rectum and the urethra. So what are the functions of the pelvic floor from what we have seen? Support of the abdominopelvic viscera. So above this we have the pelvic viscera, and above the pelvic viscera we have the abdominal viscera. We know that the abdominal cavity and the pelvic cavity are continuous together. There is no anatomical separation between the abdomen and the pelvis. So they are continuous. So the abdominal and pelvic viscera inferiorly they are supported by the pelvic floor, resistant to increase in intra-abdominal or intrapelvic pressure during activities such as coughing or lifting heavy objects, or defecation, urinary and fecal continence. It make the urethra and the rectum and the vagina, it make them continent and closed. Okay, so they have this sphincteric action. To pass urine or to pass feces, we have to relax to allow urination and defecation, and definitely childbirth, for example. This is a picture which you will use a lot. We are looking at the pelvis, and this is the pelvic floor, and you can see in different color the components of the pelvic floor, which we will examine in the next slides. But here you have the rectal opening, have the vaginal opening, and we have the urethral opening. These three openings, they are supported and they are made continent by the pelvic floor. Let us start with the most important muscle in the pelvic floor, or the pelvic diaphragm, which is levator ani. This is a broad sheet of muscle. It is composed of three separate paired muscles: pubococcygeus, puborectalis, and iliococcygeus. And let me make you a notice here, the names are descriptive. When we say this muscle is pubococcygeus, it attaches to the pubis and the coccyx. When we say this is puborectalis, it attaches to the pubis and the rectum. When we say iliococcygeus, this is attached to the ileum and to the coccyx. Okay, so these names are descriptive. If you look here at the highlighted muscles, these are the three parts of the levator ani: iliococcygeus, and then pubococcygeus from the pubis anteriorly, and from the pubis itself but to the rectum we have puborectalis. Okay, puborectalis, the one most posteriorly here in violet, this is coccygeus. Okay, so these are the three parts of the levator ani, which are supplied by the anterior rami of the sacral plexus. This muscle, puborectalis, is very important, as its name indicates. It attached to the rectum, and it forms sling around the rectum, and it maintains fecal continence. It prevents passes of feces and flatus unless during defecation. From the puborectalis, we have some fibers which make a U-shaped sling also around the urethra and the vagina in female, and they are named pubovaginalis or sphincter urethrae. So the puborectalis can have two other parts. In females, in males we have the sphincter urethrae definitely, but in females we have pubovaginalis. These muscles will appear in this. So it is U shape here from the pubis to the pubis around the rectum. If this is the vaginal opening, this is the anterior perirectal fibers, which are pubovaginalis and the sphincter urethrae. Okay, some of the fibers pass from the pubis around the urethra or around the vagina or around the rectum. So these three muscles, as we mentioned in the functions of the pelvic floor, they make continence of these openings. This is very important picture. Look here, this is puborectalis. It pulls the rectum anteriorly and make this acute angle. Look at this angle. This angle is important for prevention of fecal incontinence. Feces will not pass unless this puborectalis relax, and the rectum will be straight and it will allow for passage of feces. Okay, so this is like a sphincter around the lower rectum here. This is puborectalis. The pubococcygeus, this is the bulk of the levator ani muscle, and as we mentioned, it is puborectalis and iliococcygeus. Okay, this is pubococcygeus from the pubis to the coccyx posteriorly. Okay, it insertion here at the coccyx and it originates from the pubis. This is pubococcygeus. Iliococcygeus, the third part. This is a thin muscle which forms the posterolateral part of the levator ani muscle. Okay, so this is uh, pubococcygeus and this is iliococcygeus in green. The other muscle in the pelvic floor, so we said the pelvic floor we have levator ani and coccygeus. The other muscle is coccygeus, is the small triangular muscle located posterior to the levator ani muscle to complete the pelvic floor. As you will see here, this is levator ani, but here we have coccygeus. This is the symphysis pubis anterior. So here we have levator ani with its three part, and most posteriorly we have coccygeus. One of the clinical facts about the pelvic floor is pelvic floor dysfunction. What if the pelvic floor muscles are not functioning? If the muscles are cut or the muscles are weak, the nerve supply is injured. So what happens? We have a condition, a serious condition, which is called pelvic floor dysfunction. And as the function of the pelvic floor indicate, in pelvic floor dysfunction we have urinary incontinence, fecal incontinence, genitourinary prolapse of the vagina, the uterus, pelvic pain from the stretch of the ligaments, and definitely sexual dysfunction. The causes include for pelvic floor dysfunction, obstetric trauma, trauma during delivery, increased age, old age, obesity, and chronic strain. So if in a normal floor, the rectal opening, the vaginal opening, and the urethral opening are straight, they are continent, they are closed, they are in place. Look at the pelvic floor here. If the pelvic floor relax these openings, you can see that there is descent of the rectum, there is descent of the uterus and vagina, and similarly for the urethra and urinary bladder, there is continence of urine, and urine is passing all the time. Okay. If you have any question, please just pass them to me. I will be happy to answer them. In summary, we talked about the pelvic floor, which is formed of levator ani and coccygeus. We talked about the parts of the levator ani, puborectalis, which may has other parts like pubovaginalis and sphincter urethrae. Then we talked about pubococcygeus, which is the main part, and the iliococcygeus, which is a narrow part. And then we have coccygeus muscle. We talked about the importance of the pelvic floor muscles in the continence, in the support of the abdominal, in prevent of or support during increased intra-abdominal pressure, and we talked about pelvic floor dysfunction. Thank you very much. I hope you enjoyed this session. please go back to your textbook. You will find more details about the muscles, more details about the pelvic floor.